Welcome back to Show Me St. Louis. Healthcare costs are at an all-time high and many people have to wait weeks to see their doctor. That's led to skipped doctor's appointments and not getting the care that they need, but a few local unions are combating the problem, making healthcare affordable and convenient. Malik Wilson visited Everside Health in St. Peters to learn more.
Paul, thank you so much for joining me here on Show Me St. Louis. We're pleased to have you.
Well, thank you.
Yes, sir. And so, if you don't mind, just please explain to us where we are right now.
Yeah, so you're here at Everside Health. We're one of the largest direct primary care providers in the country, basically providing affordable and accessible health care. We provide care to unions and employers and their folks. Nationwide, we're contracted with more than, I believe we're over 35 different unions nationwide now, over 150,000 members that we take care of, allowing them access to good, affordable care. And yeah.
You know, Paul, how does Everside Health differentiate from other healthcare providers?
Yeah, well, it's a very different model. When you think about traditional models of care, they're all based on fee for service. So doctors are seeing patients being paid basically by the number of patients that they can see in a day. So the more people you see, the better off things are, which of course leads to some issues with appointments feeling very rushed and that sort of thing. Here with the direct primary care model, we're allowed to take a little more time with our patients and really get to know them and address all the other issues that patients are having. So we can spend time talking about all their chronic healthcare needs as well as their acute care needs.
So Paul, as a doctor here, what kind of drew you in?
Yeah, so with Everside, again, that model of just being able to spend time with my patients and getting to know my patients. One of the things we know from healthcare is that if you have a good relationship with your doctor, a good therapeutic relationship, you're much more likely to be able to be engaged in your healthcare. And our goal here is to help people live their healthiest lives. To do that, we've got to know more about you. And so having this model where we schedule more time for a visit, I'm going to spend a lot more time asking you questions about things that, well, maybe you came in for a cough, and next thing you know, we're talking about your blood pressure issues, your stress at home. Is there something going on? Is there some anxiety that you maybe didn't want to mention, but now that we're talking a little bit and we get to know those things, really getting that bond with our patients, and that is just, it's so different.
Sounds like a win-win for everyone.
Yeah, absolutely. I mean, this is great for patients. They get their care really at a deeper level. It's great for the unions and the employers. So they're saving money basically on this, because when we're taking care of our patients like that, it allows us to get into that comprehensive care, that preventive care, identifying things before they become major problems. So we're keeping people out of the ERs and hospital care where it's a lot more expensive to take care of. It's great for the docs as well. I mean, we get a much more enjoyable experience, not feeling rushed, not feeling stressed out, able to really focus on those patients. So yeah, everybody wins with this.
For sure. Paul, thank you so much for joining me on Show Me St. Louis. Everside Health, everyone, is a great place. You guys can check them out, and hopefully we can come back and not, on the unhealthy side, but
Absolutely, absolutely.
Thank you so much.
Yeah. Oh, my pleasure, my pleasure.
You can find more information by visiting that website or calling the number right there on your screen. We'll be right back.